All right, too tough to comply, masculinity, femininity, and compliance with COVID-19 restrictions. I'm Angie.
And I'm Heather.
And I'm Leah.
As of October 25th, 2020, the number of nationwide coronavirus cases in the United States has now surpassed 8 million, with over 2,200,000 known deaths. Since the beginning of the pandemic in March, states across the country have worked with the Centers for Disease Control and Prevention, otherwise known as the CDC, to try and prevent the spreading of the disease. These preventative measures include social distancing and face mask wearing, among other things. Despite still rising cases, individuals across the United States are reluctant to adopt this new lifestyle of wearing masks and staying socially distant. As a result of this, researchers have been attempting to explain why people are so disinclined to consent to these new rules. We predict that one's masculinity and femininity may influence whether or not one complies with CDC guidelines. According to data from the CDC, COVID-19 has been the cause of death for at least 17,000 more American men than women. Prior research has shown that men are more likely to drunk drive and 10% less likely to wear their seatbelts compared to women. Now, research looking at masculinity alone as a predictor of mask wearing found that those who are more masculine are less likely to wear a mask amidst the COVID-19 pandemic. Overall, men simply seem less worried about the virus than women. Studies have found that women are more cautious about COVID-19 and are more likely to follow the CDC's advice of mask wearing and hand washing. One study run in the US showed that women reported a greater degree of social distancing and hand washing. A different study run by the same group was conducted in 3 northeastern states and found that a greater percentage of women also wore masks in public. Women are more likely to follow the CDC's advice of mask wearing and social distancing as well. Looking at masculinity, the Conformity of Masculine Norms Scale, otherwise known as the CMNI, has been used in previous research to measure masculinity. In this study, we are looking specifically at the subscales risk-taking and playboy. Research looking at masculinity alone as a predictor of mask wearing found that those who are more masculine are less likely to wear a mask. One study looking at masculinity and femininity in government leaders and the COVID-19 pandemic stated that masculine leadership style is more task-focused, looking at the virus as almost a war. This can result in these leaders ignoring the advice of experts and science in order to maintain their independence and authority, as well as being overly dismissive about the severity of the virus. The Conformity to Feminine Norm Scale, otherwise known as the CFNI, breaks down femininity into several subscales and has been used in previous research to measure femininity. In this study, we are looking specifically at the subscale Care for Children. There is no prior research looking at femininity as a predictor of complying with CDC guidelines. One study looking at masculinity and femininity in government leaders and the COVID-19 pandemic identified feminine attributes as warm, gentle, sympathetic, sensitive to others' needs, and tender. They went on to say that a feminine leadership style places high value in others' lives, and these leaders are more likely to be role models for their community. This includes social distancing and wearing masks themselves. Our hypothesis is that individuals who score higher on the CMNI are less likely to adhere to CDC guidelines. Those who score high in the CMNI subscales, risk-taking and playboy, will be less compliant than those who score lower. So therefore, those who are more masculine are less likely to comply. On the other hand, those who are high in femininity, specifically high in the subgroup Care for Children, are more likely to comply with CDC guidelines. Our methods.
All right, so we had a total of 243 participants. 164 were recruited through SONA and 79 were recruited through social media. They ranged in age from 17 to 70 years old with an average age of 29.66 and a standard deviation of 15.83. For our demographics, our year in college, our majority were 37% first-year students, 11% were second years, 11% were also third years, 7% were fourth years, 2% were fifth years, and 32% were not in college. For race, the majority was white at 74.9%. 8.6% were Black or African American, 3.3% were East Asian, 0.4% were South Asian, 5.8% were Latino, 0.4% were Middle Eastern, 0.4% were Native Hawaiian or other Pacific Islander, 3.3% were multiracial, and 2.9% were other. For our sexual orientation, the majority was straight at 81.5%. 3.7% were lesbian or gay, 9.9% were bisexual, 2.9% were pansexual, 0.4% were asexual, and 1.6% said other. And finally, for socioeconomic status, the majority at 51% were middle class, 1.2% were poor, 13.6% were working class, 30.9% were upper middle class, and finally 2.9% were wealthy. Our participants were recruited through the general psychology subject participant pool and through various social media outlets. Those who were recruited through the participant pool did receive partial credit for their participation. Participants completed our survey through a secure link on Qualtrics. The CMNI, the Conformity to Masculinity Norms Inventory, is a 30-item, 10-factor questionnaire that assesses whether an individual conforms or does not conform to the actions, thoughts, and feelings that reflect masculine norms. This is measured on a 4-point Likert scale, with 1 being strongly agree and 4 being strongly agree. The higher scores suggest a stronger conformity. The subscales are winning, emotional control, risk-taking, violence, power over women, playboy, self-reliance, primacy of work, and heterosexual self-presentation. The subscales that we chose to include in our study are emotional control, risk-taking, violence, playboy, and self-reliance, and we found a high reliability in all of these subscales. For the CFNI, the Conformity to Femininity Norms Inventory, this is a 45-item, 10-factor questionnaire that assesses the effective cognitive and behavioral levels to an array of feminine norms. This is also measured on a 4-point Likert scale, from 1 being strongly agree to 4 being strongly disagree. And again, higher scores suggest a stronger conformity to these femininity norms. The subscales are relational, sweet and nice, invest in appearance, domestic, care for children, nice in relationship, modesty, sexual fidelity, and fitness. And the subscales we chose to include in our study are invest in appearance, domestic, care for children, nice in relationships, and sexual fidelity. And 2 of these subscales, care for children and sexual fidelity, showed high reliability. The COVID behavior scale assesses the compliance with behaviors that help to minimize the spread of COVID-19. These guilty-free answer choices allow for respondents to report non-compliant guilty-free responses more accurately. This has 4 items and is also measured on a 4-point Likert scale, from yes, occasionally, only when necessary, and no. Yes, occasionally, and only when necessary are scored as a 1, and no was scored as 0, and this showed low reliability.
And now for the results. The means for all our variables are shown on this table before you. We have the actual mean and then the possible ranges and the actual ranges. For our scale, you will notice that the CFNI sexual fidelity has a range of 6, and that's because we accidentally placed this scale on a 7-point Likert system. Bivariate correlations measure the strength and direction of linear relationships between pairs of continuous variables. For our study, we chose certain subscales from the Conformity to Masculine Norms Inventory and from the Conformity to Feminine Norms Inventory to assess with our COVID behavior measure scale to see if there was any relationship to compliance with the CDC guidelines during a pandemic. The CMNI had positive coefficients, which indicate that when the value of one variable increases, the value of the other variable also tends to increase. In terms of our study, this means that as an individual scored high on the masculinity scale, they are more likely to not comply with following CDC guidelines. We found 2 subscales to be the most predicting scales. risk-taking, and violence. The CFNI had a negative relationship with the COVID behavior measure, showing that as scores on the CFNI increased, they were less likely to not comply with following CDC guidelines. Hierarchical regressions, predicting behavioral compliance. We ran a hierarchical regression with step 1 being the CMNI subscales. Risk-taking had a beta coefficient of 0.189 and violence had a beta coefficient of 0.194. These two subscales were both significant at the 0.01 level. Risk-taking had a significance of 0.005 and violence had a significance at 0.004. The R-squared change for this first step was 0.093 and the F change was 0.000. At step 2, we added the subscales from the CFNI to see if they could add any statistical significance in the amount of variance after accounting for the variables from the CMNI. We found that CMNI risk-taking and violence were still the only statistically significant subscales. Risk-taking had a beta coefficient of 0.196 with a significance at 0.004, and violence had a beta coefficient of 0.222 with a significance of 0.002. The R-squared change for the second step was 0.010 and the F change was 0.752. We found that adding the subscales from the CFNI to improve compliance to following CDC guidelines had no statistical impact. And now for our discussion. There were some limitations to our study, and I will go over them briefly. For our demographics, we had mostly white first-year students from UMW complete our survey. In regards to gender, we did not have gender in our survey questionnaire. For our set of questions, we chose certain subscales from each of the primary scales of the CMNI and the CFNI to assess for our study. In regards to reliability and variance, there are other variables that could have been measured in this study.
So to reiterate our initial hypothesis, we predicted that those who scored higher in the CMNI were less likely to adhere to these CDC guidelines, and that those who scored higher in the CFNI were more likely to adhere to CDC guidelines. And what we found was that people did tend to score higher on the CMNI, specifically the subscales risk-taking and violence were more likely to predict less adherence to these guidelines, although the CFNI showed no significant effect.
One thing future research could look at is participants who aren't going to face consequences other than getting sick for not following the rules. As Heather mentioned in limitations, most of our participants were students at Mary Washington who were threatened with suspensions and expulsions for not following these CDC guidelines. So it would be interesting to see who complies with these guidelines on their own accord. Another thing future research could examine is the CMNI subscales that were significant predictors, violence and risk-taking. Additional research has found that gender-based violence has increased since the first lockdown to the point where the UN has put in place gender-based violence prevention as a component of COVID-19 recovery plans. While this isn't exactly related to our experiment, it's important to note that there has been an increase in violence overall during this time, particularly in men against women. Our study didn't get data on gender, so future research could definitely look at gender as a predictor of following CDC guidelines. And overall, there should just be more research on femininity. As far as we know, we are the first experiment to look at femininity as a predictor of following CDC guidelines and overall femininity with COVID in general.
In conclusion, are we on the verge of another lockdown? Our hospitals are overrun, Our first responders are overwhelmed and overworked. We have to have compliance and not politics in order to get ahead of this pandemic spread. Thank you.
Thank you. How do I stop recording?